Is it okay to use mouthwash?
It's fine not to use it. And some mouthwashes can...
Oh my god.
To be honest, it's bleach that we are using.
Yeah.
That's whitening our teeth.
Why do people have bad breath even after brushing their teeth twice a day? I have heard somewhere the coke can dissolve the teeth as well. Is it true? Oh my god. How did cavemen manage to maintain a healthy teeth, Didi?
I don't think they maintain a healthy teeth.
Welcome to Niche with Diksha. Today I have another very special guest, Dr. Pragya Shree Chamlagai. Thank you so much for coming to my podcast today.
Thank you for having me, Baini.
So let's get started. Why is it important to brush our teeth?
It's very important to brush our teeth because everything starts from oral health. That goes to your general health. So it's very important that you brush your teeth twice a day.
Twice a day, okay.
Yeah.
So what sort of bacteria do we have in our mouth?
Our mouth has both good and bad bacteria, and they are in stable form.
Okay.
And our job is to keep them that way. Our job is to keep them healthy there.
Okay. You know, we have many oral products, like you can see in here as
Yeah.
well. So which is the best one?
What, toothpaste-wise?
Yes.
To be honest, any toothpaste that has fluoride that's
Fluoride,
adequate
okay.
for the age is fine. You don't need a high good brand or company or anything. I mean, everyone is fine until and unless they have the right
Okay.
amount of fluoride.
So what is the right amount of fluoride?
For adults, it's 1350 to 1500 parts per million, ppm.
Okay.
It is less for kids, and there are patients who are very high risk in caries and stuff. So for them, we have a special kind of toothpaste that can be prescribed by the dentist that are high in fluoride, higher than the ones that we find in supermarkets.
Okay. So comparing these three toothpaste, which one do you think is the most good one?
Oh, you've got lots of them here.
Also, the price point is very high, isn't it? The Oral-B is quite expensive, and then
This
come
is
down
extra
to-
white. So
okay.
this is kind of like a whitening toothpaste.
Oh, okay.
These two are normal ones.
Okay.
So they all have fluoride, but this one has a whitening agent as well.
Okay.
So yeah, that's the difference. But to be honest, any one that has fluoride, just a normal one is fine for a normal person.
So talking about mouthwash, is it okay to use mouthwash?
Mouthwashes, again, they don't have significance of their own.
Okay.
People normally use it for extra freshness or when they are a bit paranoid that their breath is smelling or something.
Yeah.
That time is when they use, or some just have habit of using it.
Okay.
They don't have their own significance. So me as a dental professional, I would say it's fine not to use it.
Okay.
And some mouthwashes can stain your teeth as well.
Oh, is it?
Yeah, so...
Oh my god, I want to know which which one is it?
I can't tell which is a specific one, but then some of them do. So I personally don't use mouthwash. And one other important thing is when you are using the mouthwash, try not to use it after you brush your teeth.
Oh, okay.
That's what most of them do.
Yeah, that's what I've been doing now.
Yeah, but when you mouthwash after you brush, you are basically rinsing away all the good fluoride of the toothpaste.
Oh my god,
So
yes.
you want to do it either before or you want to do it after lunch or something, at a different time.
Oh, okay.
Yeah.
So it is not mandatory to use
It's not
mouthwash?
mandatory, no.
Oh, okay. Dentist approved, guys. So, like you said, how many times do we need to brush our teeth?
And twice a day.
Twice a day. Is it after breakfast, after lunch, or...
Once in the morning, once in the at night before you go to bed. The evening one, it should definitely be after your dinner.
Okay.
Morning one, either before or after breakfast is fine. I personally would prefer after breakfast.
After breakfast, okay. So which brand do you think is good for a 1-year-old baby? Toothpaste brand.
Oh, there are lots of them.
Any specific?
Oral-B do good.
Oral-B. Okay.
Oral-B. Even Colgate is fine. They just know the right amount of fluoride for the kids.
Okay.
So age-appropriate toothpaste, like I already said, that should be fine for a 1-year-old baby.
Okay, then moving on. What is the right way of brushing our teeth?
A right way of brushing. I mean, there are so many brushing techniques that we studied when we were students. But But the right way is, as an adult, your toothbrush should be angled 45 degree to your gums.
Okay. Can you show it
Yeah,
in
sure.
here, please?
Thank you for bringing this. So I've got this. Let's suppose this is your jaw or your mouth, your teeth, and I've got a toothbrush here. Apply a pea-sized amount toothpaste for an adult.
Okay.
And angle your toothbrush 45 degree. The bristles should be 45 degree.
Okay.
And normally one brush can cover like 3 teeth. So
Okay.
give it a slightly round vibratory motion and swipe it off. Vibrate and swipe
okay.
it off. Move, vibrate and swipe it off.
Oh, okay. So
Vibrate
this is
and
the
swipe
right
it off.
way. Oh
So this
my
is the
God.
right way. This way you'll be massaging your gums as well.
Ah, okay.
But then now you've got electric toothbrush, so you don't
Yeah.
need to vibrate. It vibrates it for you.
Oh, okay.
So it's
So you know,
easier.
I've been doing it wrong today because I have been going back and forth.
Have you?
Yeah.
Only for these top surfaces, you can just give them a nice scrub.
Oh.
For the inside, just a vertical scrub. Make sure you are massaging your gums.
Oh, okay.
And another very important thing is try not to press too hard. Try not to
In gums.
overbrush.
Oh,
Yeah. Again, when you are using an electric, it knows the right amount of pressure to deliver. And when you are
okay.
using a manual, it's fine to use it, but make sure you don't press too hard.
Okay. Because I have been doing it wrong. My whole life has been lying. Because I've been going back and forth. Because I didn't know about the massaging.
Yeah.
Yeah.
Just a gentle massage to your gums and you swipe it off.
So, okay.
Technical term, this is called a modified Bass technique.
Okay.
Yeah.
So why is massaging gum important today?
Gum health is very important. Like that's where most of the plaque bacteria is.
Oh,
So
okay.
you don't want the plaque to get inside your gums, and you don't want the plaque to stay there and form a tartar or a calculus, is what we call.
Okay.
That's basically plaque that's hardened. Like normally, sometimes we see like a yellowish hard substance in our teeth that cannot be removed when
Yeah,
we
I
are
think
brushing.
at the end.
Yeah, mainly at the end
okay.
towards the gum line. So we don't want that to happen, and also we don't want the plaque to get inside the gums.
Okay.
That can cause gum disease and stuff like that. So
okay.
that's the reason we need to be brushing the gums.
Okay, wow. So brushing gum is important as well.
Yes.
So do you recommend electric brush today, or do you recommend like this general brush?
I would recommend an electric. However, I know people and I do have patients who don't like electric at all.
Okay, why is that?
It just puts them off. Like they don't like the vibration
okay.
yeah, some of them. So in that case, I'd say manual is fine as long as you are brushing properly. I always say to my patients like time and brush. Time 1 minute for the top, 1 minute for the bottom. Like divide your mouth into 4 parts.
Okay.
Spend 30 seconds, 30 seconds, 30 seconds, 30 seconds. And in that 30, do 15 on the inside and 15 on the outside.
Oh my God.
Yeah, so that you do the same on all the teeth
Oh
because
my
all
God.
of them are important.
Yeah, because the thing is, I think I brush my teeth around like 30 seconds overall.
Yeah.
Oh my God. So
no,
2 minutes.
Yes, please.
Mandatory.
Yes, please.
Oh my God. Okay. This is the new thing. Okay. So, some people have the habit of brushing very harshly.
Yes.
Is it harmful for our teeth?
It is harmful for our teeth. It can cause teeth surface loss. We call it TSL. One of the major reason of tooth surface loss is overbrushing, like brushing too hard. So yeah, it's not good.
Oh, okay. Because some people have, their bristle. We call bristle, isn't it?
Yeah.
Yeah, the bristle is like spread all over.
Yeah.
So I think, like, how are they brushing the teeth?
Yeah. Also, like, we had kind of misconception when we grew up. Like, the harder you brush, the better you brush, isn't it? But that's not right.
That's not true.
No.
Yeah. Okay. The right amount of toothpaste, you already said, like a pinch.
Pea-sized.
Yeah, pea-sized.
Size of a pea.
Let's talk about floss today. Is floss useful?
Floss is very, very important.
Okay.
Unlike mouthwash, it's very important.
Okay. So you recommend floss?
Yes.
Okay. So how to use floss?
There are so many kind of floss available nowadays. You've got a traditional string one,
Yeah.
and you've got the string in a handle.
Yeah.
And you've got little tiny interdental brushes.
Okay.
You even got electric water flosser.
Oh, okay.
So the best one is the tiny little brushes
Okay.
to clean in between your teeth. What I say is try to get in between all the gaps.
Okay.
All the gaps from back to the front and front to the back again.
Okay.
That is very good if you can get the brushes through. However, in some cases, the teeth are too tight. So in those ones, just take a string and try to get in between.
Okay.
And again, you need to be touching your gums and cleaning the gums very well as well.
Okay.
Yeah.
Okay. So, like, how long do we need to take the floss?
A good amount, I would say.
Is it
should
like a
be
palm?
enough to swirl around your hand
Okay.
and floss. And with the interdental brushes, they come in different sizes. So if you go and see your hygienist or your dentist, they'll let you know the right size for you,
Okay.
and you can do it.
So it all differs from
It
mouth to
all
mouth.
depends on your individual, yeah.
okay.
The size of your gaps in between your teeth, the health of your gums.
All right. Okay, you talked about brushing at night today. Why is brushing at night important?
Brushing at night is very important. It's even more important than brushing in
Brushing
the
at-
morning.
yeah.
So
I've
the
heard
thing
about it,
is,
yeah.
Once you go to sleep, you don't move your mouth, or your mouth is just there stagnant, and that makes your mouth very dry. So it
okay.
gives the bacteria to invade, and it gives them more chance to get inside your teeth and cause problems like caries. So in the morning, after you wake up, you have more salivary flow in your mouth, but that doesn't happen at night. So your
Okay.
mouth is drier at night.
Okay.
So that's the reason it's important you brush at night.
Okay.
You brush both times, it's very important, but nighttime is more important.
More important.
yes.
Okay. So you talked about dry mouth. So what causes dry mouth today?
Oh, there are so many things that cause dry mouth. One of them could be smoking.
Okay.
Like, it is one of the major reason of literally all the problems in your mouth.
Oh my God. Okay.
Yeah. So the other can be some kind of food that we take. Like, some of them are can naturally cause your mouth to be dry. Other ones sometimes can be caffeine as well.
Caffeine. Oh.
Yeah, but then again, in moderation, it's fine. But it can dry your mouth, and sometimes there are certain medicines, like some high blood pressure medicines, and those can cause your mouth to get dry. Yeah, so
So how harmful is dry mouth?
in general, just a moderate dry mouth, I wouldn't say is very harmful. But then if your mouth gets really, really dry, it can lead to more caries in your mouth.
More caries.
Yeah, more cavities.
Cavities,
Decay.
okay.
So it is, if you feel that your mouth is very, very dry, then it's worth going and seeing a dentist, because there could be something underneath it.
Okay. Moving on to this, some people bleed while brushing. Why do you think that is?
Bleeding is just a sign that's telling you that there is something
Problem.
there. You should be cleaning your gums more better. You should be flossing. Should be using the
okay.
interdental brushes. Once you start flossing every day, or using the interdental brushes or things that your hygienist or dentist advise, in a few weeks' time, anyone will notice that the gums will feel better.
Okay.
I mean, again, you'll have to be seeing your dental
Dentist.
professional as well. But in the meantime, it's very important that you
Take care
do
of
your role from your side. If
Okay.
you floss every day, you will notice the difference. Your gums will feel so much better.
Okay, so how many times we should floss in a day?
Ideally, twice a day.
Twice, like after brushing.
I would say before you brush
Before
your teeth.
brushing, oh, okay.
It can bleed, so you want to rinse away all the blood before you brush.
Okay.
Ideally twice, but then I know everyone is very busy. So at least once a day. That's what I tell my patients.
I don't floss. I don't think I have flossed like in a week. So okay, so twice a day.
At least once.
Okay.
Once you get used to it, it takes like less than a minute. So
okay.
it doesn't feel like a chore to do. You just get into the habit of it, and it gets easier.
So let's talk about bad bacteria, Didi. How harmful are bad bacteria in our mouth?
Bad bacteria itself is not harmful. as long as you are doing the job from your side, keeping your mouth very clean.
Okay.
But if you are not cleaning, not brushing well, not seeing your hygienist or your dentist, and not basically knowing what's going on in your mouth, then that's not very good. Like it can cause problems, like you could be having a teeth decay that can be in initial or like mild stage, and you could not be knowing about that.
Okay.
So if you don't go and see your dentist, you will not know about it. Similarly, you could be having gum problems, but then you could just be not knowing. So bacteria itself is not harmful, but if we do not look after your mouth, then that can get harmful.
Okay. So what causes tooth decay, Didi?
Tooth decay is basically demineralization of the enamel that you've got in your teeth. Demineralization manale. It starts getting softened.
Okay, the teeth.
Yeah.
Okay.
The teeth starts getting softened and bacteria start invading it. So there's a role of sugar or carb. So if we eat, we just leave it there, we don't clean it, then the carb and the bacteria together, they start demineralizing the enamel.
Okay.
Once the enamel is invaded, they go to the inner layers of the teeth as well.
So is it,
that causes
you know,
caries.
some people have like black like rust brownish in the teeth. So is that the tooth decay?
That could be tooth decay, or that could be
or like a
just
hole?
stain as well. Yeah, that could be a hole, or
okay.
that could be just a stain. Yeah, it just depends on what kind of black mark is there.
Oh my God. There's so
much.
Yeah, there's so much. Yeah. Okay, let's talk about how many times in a year a person should see the dentist.
In the UK, they put you on a regular recall. So the dentist will decide how often you should be seen.
Oh, okay.
So for a normal healthy mouth, it can be 12 months.
Okay.
Or it just depends on what your dentist thinks about your overall health.
Okay.
If she or he needs to be seen more regularly, they'll put you on like 3 months recall.
Okay.
So it just depends.
Okay. So why is it so difficult to get into NHS?
NHS dentistry, I am not a dentist here yet. I'm a dental hygienist. But I know how difficult it is to get an NHS dentist.
Yeah.
Like both dentist and hygienist, it is a very high demand
Yeah,
career
in the
here.
UK, yeah.
And
Also, the money is very good.
apparently, they don't have enough dentists. I mean, that's what this morning I was just reading a news regarding. It was from a British Dental Association in my
okay.
Instagram that was saying somewhere in Somerset, in General Hospital A&E, there were people queuing because they had teeth pain and they couldn't get a dentist.
Oh my
so
God.
poor, they can't do anything. They just need to go to A&E, isn't it? So yeah, I think NHS is trying to bring more dentists, giving opportunities for overseas dentists as well.
Okay.
But yeah, at the moment it is quite difficult, I know.
Okay. So how do you know someone is a good dentist? How can we know, like a normal person?
Dentist, or in general a dental professional, it could be a dentist or a dental hygienist or a dental therapist or even a dental nurse.
Is there dental therapist as well?
Yes, there is. Yeah.
So how is that? What is that?
It's a kind of a dental professional.
Okay.
So what I would say in a patient's perspective is that everyone knows the skill. Some can be good, some can be practicing more experienced, some can be less experienced. Everyone knows the skill. You don't qualify from a dental school unless you know the skill. But the most important thing for me is how you greet the patient,
Okay.
how effective is your communication, how you explain what the patient is asking you,
Okay.
how you tell the patients about the treatment plans, how you, even simple things like how you tell them to brush, floss, the way you present, your chairside manners. I mean, if I'm a patient, when I go inside, I don't know the skill.
Yeah.
But then the first thing that I see is how the dentist or the dental
Yeah.
hygienist greet me,
Yeah,
how they make me feel.
Yeah,
So yeah,
so
I think that is first thing that's most important to be a good dental
dentist.
professional. Yeah.
Okay. Yeah. Whatever you're saying, yeah, it's making sense. Everything is
Yeah.
making sense. Yeah.
Yeah.
Because even if that doctor is like really good, at his
Yeah.
profession. But if it's like the way of treating you is poor, then I don't think he will be described as a good dentist.
Yeah.
Yeah. Let's talk about whitening toothpaste. So you said this is the whitening toothpaste?
Yes. One
Okay.
of them. Yeah.
Yeah, the Oral-B one. So is it good for our teeth?
Again, whitening. What I would say as a dental professional is, please go and get whitening from your dentist,
And not
or
use
your
the
or your
toothpaste.
dental hygienist.
Okay.
I would not use anything over the counter because, to be honest, it's bleach that we are using.
Yeah.
That's whitening our teeth. So your dental professional knows the right amount of bleach, and they give you a prescription.
Okay.
Like nothing over the counter. They give you, they prescribe you, or if they do something, we call it in-house whitening. That is
in-house
done within the
whitening.
clinic. That is also prescribed. So that's more safer.
Okay.
I have seen patients who have very sensitive teeth because they used just something
tightening.
over the counter, and
Yeah.
that made their teeth very sensitive.
Yeah, I've heard about that because a person used the whitening toothpaste,
Yeah.
and then they had the enamel.
Yeah.
Enamel, is it? The enamel, it wears
Worn
off.
off,
Yeah,
yeah.
yeah. Oh my god. So that's the problem with the whitening toothpaste.
Yeah, I mean, I can't say that they are not good, but to be on the safer side, it's best to speak to your dentist before you use any whitening products.
Okay. Why do people have bad breath even after like brushing their teeth twice a day? Is it because they are not brushing it properly?
Proper way could be, yeah. I mean, there are, again, different factors that cause the bad breath. One could be, although they are brushing every day, they might not be brushing properly, like using proper brushing techniques or brushing for enough time.
Okay.
Or they might not be flossing.
Okay.
Flossing is also very important. Like once you start flossing, you know how much is there. Like you want
How important it is.
how important it is. One could be they are not flossing. Other could be they might have some infection or some pus that's draining.
Okay. Is it the oral health or?
Yeah, oral health.
Okay.
Just within your mouth, you could have some infections, and that can cause bad breath. Sometimes bad breath can also be caused by your gut problems.
Gut problem.
Yeah, if you have some problem in your tummy, or your gut health is not good, or you have got like very high acid reflux and stuff, that can cause bad breath as well.
Okay.
And again, smoking.
Smoking is the
Smoking is
real problem.
The real problem here.
Okay. How can someone take care of their bad breath?
First, like brush in the right way for the right time. Use interdental aids, floss, interdental brushes and stuff. You can also use like mint chewing gums and gums that are like easily
Is
available.
it okay to use?
It is fine.
have-
We just need to be careful that it's sugar free.
Mm.
Chewing gum is very good for your jaw as well.
Oh,
It's like
okay.
a jaw exercise,
Okay.
but then in moderation again. And if you still have bad breath, sometimes you can just be paranoid. Like you don't have it, but you feel that you have it.
Yeah. Okay.
You can always ask your dentist or your
Someone you
dental
know.
professional to look after. And if
okay.
it doesn't go away, then they might refer you for like general investigation and everything.
Okay. All right. So you talked about chewing gum. They said like it's sugar free, but still it contains somewhat of sugar. Is it really okay to use to have chewing
If
gum?
you don't have any jaw problems or anything, and if you feel that you don't need it, I would say it's just fine to avoid it. But then again, sometimes even dental professionals, they ask if they feel that you need it for your jaw, they ask you to chew it. But as long as you are doing your basic oral hygiene routine, it's not necessary. You don't need to make it a routine.
Can you say someone has like a jaw problem just by looking at someone?
Just by looking, not necessarily. I mean, sometimes you can, but then if they have jaw problem, their jaw might click when you open,
Like okay.
like kind of a sound when
Okay.
you open, or can deviate to one side if they have problems.
Okay.
Or they can have pain while opening.
Okay.
So it just depends. This is a very basic for a dentist.
Oh,
If they
okay.
see any dental problems, they obviously refer it to the specialist.
Okay. Oh my god, I'm learning so many things.
Yeah, and also sometimes you have jaw problems when you like clench your teeth
Okay.
or grind your teeth. Like sometimes even me, when I'm stressed, I grind my teeth at night. So that can
okay,
be
so making sound.
So when you are grinding, your jaw is very tired. So you feel a kind of ache when you wake up.
Okay.
So that can be the reason your jaw feels achy as well.
Okay, learning so many things. Okay, Didi, have you had any patient with bad breath?
Yeah.
How do you deal with them?
I have a mask and my
Okay.
face shield and everything. So, but then, they do have bad breath, some of them. I instruct them, I tell them what to do, and tell them if they smoke, I tell them it's very
stop
important to quit. So that's how I deal with them.
Because whenever I think of dentist working and patient with the bad breath, it's just so awkward situation, isn't it?
Yeah, I mean it's a very rare situation that you can actually smell it.
Okay, with the mask on.
With the mask on, but then sometimes again you can.
Okay. So is it true that the gut problems start with the mouth? Is it true?
Not all the gut problems.
Okay.
But it can start from your mouth.
Can you give me like example?
Not anything specific, but
Okay.
if your mouth is not healthy, it's very obvious that your bad bacteria there is getting inside your gut, and not only gut, but your entire health.
Okay, overall health.
Yeah, overall health. So it is very important that you keep them really clean. Everything starts from your mouth.
Okay. Okay, let's talk about the common, you were a dentist in Nepal.
Yes.
The common cases you have handled in Nepal.
In Nepal,
What were that?
To be honest, I qualified in 2019 December, and before graduation, I was an intern for 1 year, but we
Okay.
were under the supervision of the senior doctors. We were just an intern doctor and intern dentist, and after that, I only worked for 1 year roughly, and that was around COVID.
Okay.
So I have not come across very severe kind of cases.
Okay.
Just regular fillings, checkups.
Okay.
But there's a problem in Nepal that they only come to the dentist once they have problem.
Bigger problem.
Yeah, they don't go to the dentist for checkup.
Yeah.
Yeah, so
Why do you think that is the day?
one could be because
Awareness?
awareness, and again, we don't have government health system like NHS. Everything is private. Like we need to pay when we go to the dentist. I mean, here we need to pay as well, but it's NHS fee, NHS charge. You need to pay the same amount everywhere you go. But there, again, NHS. There's no NHS. There's no government. Nothing covers you. So that could be the reason. And again, awareness as well. Like people. It's not considered very important over oral health. So they only tend to, I mean, I can tell that it's improving now. But again, there's a long way to go.
Okay. Some of the very common cases you have dealt in UK?
In the UK, I work as a dental hygienist. So I am mostly into gums, into gum health. So I have seen like severe cases of periodontitis, which is a gum disease.
Okay.
So for that cases, I just record the measurements of their gums, instruct them properly, speak to the dentist of the patient if needed. And in severe cases, the dentist refers the patient to the specialist or a periodontist.
Okay. What was the main problem behind the gum disease?
Gum disease is, the plaque that I was talking about. It's just a white sticky substance that just forms when you eat or just in general. So if you don't brush properly or floss, get rid of the plaque basically. It, number one, can turn into a tartar or a calculus, which is a hardened plaque that cannot be removed. Number two, the plaque can get inside the gums. So once the plaque or the tartar is inside the gum line, it makes the gums swell, bleed. And once it goes more inside the gums, the bacteria will start resorbing the bones. And in long run, that's the reason people start getting wobbly teeth.
Okay.
Yeah, so that is the main reason of gum health. But then again, if you smoke or if you have family history, like if your parents had bad gums, that can come to you as well.
Okay. All right. So, what are the most common age group?
Age group 4?
Age group for like having dental issues.
That can happen to anyone, to be honest.
So, is there any there's no specific age group? Like babies, it can be adult or it can be teenager.
Teenagers, it can be anyone that's taking more amount of sugar. In Nepal, I would encounter more elderly people because they were not told that they need to look after their mouth or their teeth. But then, dental problems can come to anyone.
Okay, let's talk about some patient. Like some patients are very, very rude.
Yeah.
How do you deal with them?
Unfortunately, once you have like signed off for a career that's patient facing, you have to deal with them. So just be mindful of what you say. Try and be very calm. Sometimes they ask you all sorts of questions and they can literally get into your nerves sometimes.
How do you keep calm at that time?
I just try my best. Yeah, I just really try my best. There was once a patient who was asking me so many questions and I was running late. There were patients waiting in the reception. I was literally running late. So I had no options but to tell her, like, I'll have to ask you
to leave.
I'll have to tell you that our appointment time is over.
Okay.
If I tell I'll have to ask you to leave, then that could be another issue. Yeah. So our appointment time is over. I'll have to tell you that. They do get into your nerves. The only thing that you can do is just be calm. And if they ask you anything that you don't know, I simply say, I'll speak to my senior colleague or my principal dentist and come back to you. And then genuinely, sometimes patients do ask genuine questions, which I don't know the answer to. Them, I speak to my principal dentist and call them back. Okay. But the rude ones, they can be really rude sometimes. Like one of the lady was really, really not happy with me. But then, it is what it is.
What was they asking for?
This is just really funny. There was a tiny bit of stain on her back teeth that was literally in between her teeth where none of my instruments could reach. So I explained to her that this is a time-based appointment. Like we work in a limited time, so I can only do the best that I can. But then, she was very borderline aggressive. But then I spoke to my senior colleague, the principal there, and then he was like, she has been doing that to others as well. You don't have to worry. Okay. So as long as you are doing the right thing and you are being calm, not being aggressive when they are aggressive, then you should be fine.
Have you ever had the most funniest patient?
Oh, I have so many funny patients. Like in UK, one thing that I love about dentistry here is in Nepal, I was their Dr. Saab, isn't it? Here, I'm just a girl who's looking after their teeth. I'm their friend, like their hygienist friend who's looking after their teeth. There was once a patient who came in and said that, Pragya, I saw you at the Sainsbury's and I waved you for like 5 minutes and you didn't even look at me, you didn't even answer. And I was like, when was it? And he was like, last weekend. I was in that Sainsbury's last weekend. Okay. And I was like, oh, I'm really sorry. I think I just didn't see you. But then I see so many patients, I don't remember their name. So there's another incident as well. Like I was going through something, not dentistry wise, I was going through something, but then I was working that day. Okay. So I went to bring my patient and then the patient came in and I was like, hi, I'm Pragya. Nice to meet you. I'm your hygienist for today. And she was like, Pragya, we have already met. And that was so embarrassing. And then I look into the history and I have literally seen her twice before that.
Oh my God.
That was so embarrassing. So I always I always make sure that I look at the history because I see so many patients, but they see only 1 or 2 hygienists. Most of the time they see the same person. So that was very embarrassing. I felt bad for the patient as well. I did apologize, but that was really funny.
Oh my God. So, in this profession, do you have someone you look up to? In general, I mean, I don't look up to, like, specifically, I don't have like a idol kind of person to look up to, but then
I literally get inspired from everyone, like my colleague next door, or even you. Like, you are doing so good, I get inspired. My friends, I
Thank
see
you.
my friend, they are doing good in their life, I get inspired. My husband, my brother, I literally get inspired from everyone. I think that's a good thing as well.
Yeah. So how important it is to check the baby milk teeth as well?
It is very important, to check
Because
that.
the baby milk teeth, it will fall out after some
It will
years.
fall off, yeah.
But is it really important to check?
It is
the
very
dentist?
important in sense that they should be kept healthy so that they fall off in a sequence.
Okay.
Like every teeth, they have time to fall off. Randomly, they don't fall off. Your year summer, one teeth, that teeth falls off.
Okay.
Not exactly, but we call it dental age.
Okay.
So tentatively, to your age, that teeth falls off. So if the teeth gets decayed before that, if we have to extract it, or if it falls off, then there is chances that the other teeth move, and that's the reason you have crowded teeth in adults.
Okay.
So that starts
crowded
from
teeth
the
means,
baby.
teeth coming out like a crown.
not aligned in a right way, like overlapping and stuff. That starts from the baby teeth.
Okay.
So
Oh my
not,
goodness.
not everyone knows that, but it's very important that you.
Okay, is my teeth okay, Didi?
I think it is, yeah.
So what about the gap in between teeth?
Sometimes they are just your natural gap. Again, there are so many reasons. Sometimes your jaw space could be more than your tooth material space.
Okay.
Again, sometimes one of your teeth can fall off and the teeth can move. And yeah, there are so many reasons you can have gaps.
Okay. So the best way is to put, what is it called?
Braces?
Braces, yeah.
Again, I cannot tell the best way.
Okay.
But then, if anyone has gaps in their teeth, is concerned, you can either, if you are a certain age, and if you have your NHS dentist,
Okay.
if they see gap that's concerning, and if you qualify for orthodontic referral, they refer you. You don't even have to. You are under NHS.
Okay.
They put braces for you.
Okay.
But if you are an adult and if you feel that there's something wrong, or that there are Invisaligns and so many other ways to straighten your teeth.
Okay. So Invisalign, it is the clear form of
Clear
okay.
aligner, retainer.
Okay, retainer. Okay. So which one is most useful one, like effective one? Is it the braces or
Again,
the?
I can't tell. I'm just a general dentist. So it's the best person to ask this is an orthodontist. Or also it depends on the case. Like one could be best for someone, or the other could be best for the other one. So yeah, it just depends on.
Okay. So how long, like a general question, like how long do we need to put braces for?
Again, that depends on the case as well.
Okay.
If you have got
Okay, depends on.
yeah.
What's the minimum amount of time? Is it the? I think I've read somewhere. Is it the 14 weeks? Is it the 14 weeks the minimum?
I'm not very sure about this.
Okay.
I mean, oil like a modern Invisalign, they work quite fast.
Oh, okay.
So yeah, I have few colleagues who do Invisalign. They have done course on them. So yeah, again, it depends on how the kind of alignment your teeth has.
Okay. So the most harmful baby food for baby teeth, Didi?
Harmful in sense like for general health, obviously we have lots of baby related food now. I would say just limit the sugar,
Sugar, okay.
Even don't introduce sugar for like until 1 to 1.5 years. Even if you introduce it, just limit it. And the other thing that I wanted to mention is for the teeth, frequency of sugar is more important than the amount. Like
Frequency, okay.
yeah, if you want to eat a biscuit and a donut, so if you eat those together,
Okay.
you have one frequency. But if you eat biscuit and after 1 hour you eat the donut, you have 2 frequencies.
Okay.
So
eat it within one.
Yeah, if you
one
want
go.
to eat
Okay.
in one go like this. So that
Okay.
once the teeth is exposed to sugar, not twice. Another
okay.
thing is if you want to eat sugar, limit it to meal time.
Meal
Like
time.
because you already have carb or sugar, your frequency is only once. So limit it to meal time.
So you mean like after having our rice and dal, then eating dessert is fine?
Yeah, in moderation.
Okay. Okay. So frequency is more important,
More important.
than the
I mean,
amount.
obviously
Okay.
for your general health, amount is more important as well. But for your teeth, frequency. Limit the frequency of sugar.
Okay. Okay, so the most harmful food, is it the sugar or is it the carbohydrate, Dede?
Carb is a form of sugar, basically. Carb, the energy ko लागि pani you need ni ta. So moderation ma carb is fine. Sugar and hidden sugar pani huncha feri.
Okay.
Like if you
What's hidden sugar?
You feel like you are eating a potato. You
potato
feel
chips.
like just a normal boiled potato you are eating. You feel like you are eating just starch and healthy. But then if you are dipping it in a ketchup, the
Okay.
ketchup ma ta hidden sugar huncha ni ta.
Okay.
So those kind of hidden sugar. And again, fruit juices. Fruit juice when we feel that it's healthy,
Hidden sugar,
but it has sugar in it.
So it's not proper to give to a baby, like juices and stuff.
I would say in moderation is fine, but if the baby can eat a fruit, then eating a fruit is better than drinking a fruit.
Because I have cut my sugar off because I want to lose some weight. But whenever I have like the French fries, I always dip it in ketchup.
Yeah, I mean even I do. It's not 100% avoidable, is it? But just
Okay.
being mindful and limiting it, like frequency, mainly the frequency.
Okay. So let's talk about Coke today, Coca-Cola. Is Coca-Cola, how bad is Coca-Cola for our teeth?
Coke is very it's fizzy, it's acidic, so it can cause your enamel to soften, and chronic Coke drinker, it can cause teeth surface loss.
Okay.
So
The enamel.
upgrade huncha, enamel.
So I have heard somewhere like the Coke can dissolve the teeth as well. Is it true?
एकचोटि Coke खाँदा त just a very little amount, but then if you drink it every day, if you drink it with every meal, then yeah, that's definitely true.
Oh my god.
It's very
so it
acidic.
dissolves literally a tooth.
A very tiny particle of it, the outer
Okay.
surface.
So not the whole one, just the tiny particles like.
Yeah, अब whole teeth it doesn't get dissolved. But
When I heard that story, Didi, I was like, I thought the whole.
not
whole
the whole
tooth.
teeth surface loss चाहिँ हुन सक्छ if you
okay.
drink it every day chronically. It's not good. Same with anything that's more acidic, white wine, anything that's acidic.
Okay. So I've heard like if you are taking wine, you should take cheese as well.
Acidic or alkaline hunछ. I mean, yeah, it
So it
neutralizes.
yeah,
That does make sense. Yeah. किनभने cheese is alkaline, wine is acidic.
Wine is acidic,
so
yeah.
It's a good
Combo.
combo. Tastes nice as well.
Yeah, okay. What causes cavity in children today? Is it the sugar?
Mostly yes.
So is there any other product? Because I've seen in a vlog that potato chips.
Yeah, hidden sugar. त्यहाँमा त carb नै त हो, and there's sugar hidden. Yeah, anything that's junk and sugar that's hidden. तर यहाँनिर one good thing is once you get registered with an NHS dentist, go to them in the interval that they advise you. They put fluoride in your teeth, in baby teeth, from school going age, like 6 or 7 till you are 18. They put fluoride that gives extra protection to your enamel. And you are being monitored every 6 months by the dentist. So if you do everything right and the dentist is helping you, everything should be under control.
I have read somewhere that they like, if you have a very bad oral health, it will cause premature babies as well. Is it true?
That I don't have enough knowledge about. I have read somewhere as well. And obviously, if you have really bad mouth, it does affect your general health. So it could be, but then I cannot say it exactly is.
Okay. So is it because of the gum? Like the other
Gum
oral
has
health?
a really direct connection with your hormones and your overall health. And even in pregnancy, it's really common that you might have gum problems. So it does have a connection.
Oh, okay. Okay. Oh my God. Yes. So the caveman before, our ancestors, how did cavemen manage to maintain a healthy teeth today?
I don't think they maintain healthy teeth. I mean, they did use like bamboo shoots and stuff. We heard about that. I think that's all they did. And I don't blame them because they had nothing.
Oh, nothing, yeah. So you don't think like they had like healthy teeth?
I can't tell. I need to meet someone.
I don't think that's possible.
Yeah, no.
Okay. How harmful is pan masala and supari is for our oral health?
It's not good, no. I mean, being a Japali, being brought up in Japa, we have been seeing supari and pan since we were kids. I know.
Yeah.
Even we literally grew up in neighborhood.
Yeah.
But then it's not good. एउटा condition हुन्छ oral submucous fibrosis भन्ने. It's a pre-malignant condition. Can be potentially malignant or cancerous. One of the major reason is betel quid or like erica nut, supari.
Erica
so
nut.
That in long run gives burning sensation in your mouth, makes your mouth muscles very tight. That causes trismus भनेको. It causes difficulty in opening your mouth.
Okay.
So textbook घरमै लेखेको हुन्छ कि South Asian origin को मान्छेहरुमा it's very common भनेर.
Okay. So it leads to cancer as well.
It can lead to cancer, if not managed or if not controlled.
What are the symptoms of pre-cancer, Didi?
Anything like a patch in your mouth.
Like white patch.
White or red, that cannot be scraped off.
Okay.
Or like ulcer that's not healing, like 2 or 3 weeks.
Ulcer as in?
Mainly in the lateral border of tongue.
Okay.
If you have like a indurated ulceration kind of thing, normally the aphthous or stress ulcer that we get, it heals, isn't it?
Okay.
But if it's not healing at all, or if it's bleeding, that can be potential pre-malignant or even malignant lesion. अर्को भनेको white patchहरू भइहाल्यो. अर्को चाहिँ hoarseness of voice, like पछाडिको soft palateहरूमा. If you have something, all of a sudden, no reason, if you start getting hoarse voice or if you start getting sore throat, अर्को भनेको there's no reason but your teeth start getting wobbly, or there's no reason but something
will the teeth fall out as well in pre-cancer?
It can do, but like again not necessarily. So if that if you see something again त्यो ऊ जस्तै भयो कि ट्युबको जस्तै, if you see something that doesn't look right हुन्छ त्यही भन्नुलाई, if you see something that doesn't look right, like if it's not healing at all, mainly indurated ulcer or patchहरू that cannot be scraped off, that can be a potential sign of
oh my
cancer.
God. So is there any pre-cancer centers in UK, like pre-cancer oral centers in UK?
There are NHS services. You can just look for your nearest NHS.
Okay.
Or if you feel that if there's anything that's wrong, you can just go to the dentist. They will refer you to an oral and maxillofacial surgeon. Urgent referral पनि हुन्छ.
Okay.
So, yeah.
How fast can you cure pre-cancer symptoms?
It depends on how much it has extended to.
Okay.
And
Is it curable?
Cancer itself is curable अहिलेको टाइममा त. तर again it depends on how your body responds, what kind of clinical help you get from the oncologist and stuff.
Okay.
So yeah,
it's like a deeper.
Yeah, it's something deeper.
Very deep.
Oncologist or a cancer specialist.
Okay, moving on today. Let's talk about sensitivity in our teeth. So is water enough to rinse our mouth today? Just to rinse.
Just in general, rinsing after food, water is fine.
Okay.
With the toothpaste, you don't even need water. Just spit it. Don't rinse it.
Oh, okay. My husband, he went to a dentist.
Yeah, I think you told me that.
Yeah. The dentist said to him like, never rinse your mouth and just spit it out.
Yeah.
So why is that today?
Just to retain the fluoride. So mainly at night.
It's all about fluoride.
Yeah, mainly at night. If you can, just spit the toothpaste. Try not to rinse it. But then again, मेरो patientहरूले they do tell me, but then it doesn't feel okay. What I say is, if you feel that it's not okay, rinse it and then again rub it the toothpaste once again, just to get some extra fluoride. But if you can, it's best not to rinse.
Okay. So how do you know like someone has good bacteria? Because of the teeth, proper?
you have the good bacteria भनेर चाहिँ भन्न सकिन्न.
Okay.
But then I can know if you floss or not. If I check
okay.
your gums with my instrument, I can know if you floss or not. And I ask my patient, are you flossing? And then they'll be like,
They'll be like,
yeah. And then most of them know that I can know. Any hygienist can know. Are you using anything that
you cannot lie to me. You can never lie to doctors.
Most of them will be honest.
Okay. Do you make Sunil when I floss?
Oh yes, every day. Yeah, he has to floss. Interdental brushes, all the he's used to it.
Oh, okay. Okay. Is there any self-cleansing food for our teeth?
Necessarily self-cleansing, I can't say. Saliva itself is self-cleansing. And just water.
Just water, okay. What's the wisdom teeth, Didi? And why does it come late?
Wisdom teeth is the last teeth in our jaw. There are 4 wisdom teeth,
Okay.
top, bottom, right and left. Normally, theoretically, textbook-wise, 17 to 22 years ma aunu parne ho.
Okay.
But then it doesn't come. Like, there are so many reasons. Sometimes it's just congenital. Like, if
Okay.
it's absent, it doesn't come. Sometimes your jaw length is not enough. Sometimes they come, but then they can't erupt properly, so they come tilted.
Okay.
Tilted the other way. So, yeah. They just.
Why do we take it out? Is it necessary to take it out?
It's a vestigial organ, which
Okay.
means it doesn't have any significance.
Okay.
So if it is
No
giving
meaning.
you trouble, if you can manage it by keeping it clean, it's fine. If it's repeatedly giving you trouble, it's fine to take it out.
Okay. You already said like coffee dries out our saliva and
If excess.
Ah,
if it's
okay.
in excess.
So what is the right amount of coffee to take for our oral health?
Coffee again stains your teeth as well. So I'll have to do more work.
Good for the dentist.
Yeah. But then just in moderation, or like rinse your mouth after you have coffee, or like swirl around and drink water just to prevent stain.
Okay. So which one do you prefer the most, green tea or the coffee?
I only drink decaf coffee myself.
Okay. So I've heard somewhere that green tea is good for our oral health because it cleanses the bad bacteria and only keeps the
यसको
good
necessary
bacteria.
significance त छैन हैन. It's just that caffeine कम हुन्छ भनेर पनि हो.
Okay.
स्टेनिङ त उस्तै हो. अझै टीको बडी स्टेन त्यो इङ्ग्लिस टीहरूले त झन् त्यो इट स्टेन्स द कप पनि नि त कप पट त्यस्तै नै स्टेन हुन्छ क्या पेसेन्टमा पनि.
How bad is it tea with the sugar?
Sugar, I wouldn't say it's good. It's bad. Yeah.
Very bad.
Yeah. If you can, please don't put sugar in your tea or coffee. अघि हामी नेपालीहरूलाई एकदमै मनपर्छ नि त दुध चिया. If you can, don't put sugar.
Okay. Masala chai with no sugar.
Yeah.
Okay. Straws did
Straws are very good. के हो भने if you are drinking anything sugary, straws ले त सिधै it puts in. तितहरूसँग टच नै हुँदैन नि त.
So straws are useful.
Yeah, it's very useful.
Okay.
स्टेन पनि थोरै हुन्छ स्ट्रले कोल्ड कफीहरू खायो भने. अगेन हट कफी त it can't be possible all the time. Yeah.
Moving on, Didi, what inspired you to pursue dentistry?
I always wanted to be a doctor. बच्चा बेलामा चाहिँ I wanted to be a doctor. अनि अलिकति ठुलो हुन थालेपछि
Me too.
अलिकति ठुलो हुन थालेपछि चाहिँ I wanted something that's not very like night duties-हरू चाहिँ मलाई मन थिएन के. I wanted to have a stable life. अनि अलिकति इजी पनि हुन्छ कि भन्ने पनि लाग्थ्यो मलाई which I was wrong. Dentistry is not easy at all है. त्यही भएर पनि I went into dentistry.
Okay. So do you have any best dental college in Nepal, in your opinion?
I don't think there's any त्यो कुन आधारमा बेस्ट भन्ने नै छैन कि हैन.
In general,
I studied in Nepal Medical College, which was nice. I had a nice time. I spent 5.5 years there. Kathmandu University affiliated हो, and there are 2 different Tribhuvan University affiliated collegeहरू पनि छ, अनि अर्को धरानको BPKIHS चाहिँ it doesn't have any affiliation. It runs on its own.
Okay.
त्यो थियो मेरो पालामा चाहिँ. I'm not sure if there's any new ones now. But yeah, I think once you graduate, it doesn't matter anywhere you graduate from.
Okay. So how many years does it take to become a dentist?
In Nepal, in general, smooth, straightforward भयो भने 5.5 years.
5.5 years.
Yeah,
Okay.
long time.
So is it is it with the training as well? 5.5 years.
Internship lasts for 1 year हुन्छ. So 4.5 year studying, 1 year internship. त्यही internshipकै बेलामा एउटा General Medical Councilको exam पनि हुन्छ. That will make you registered.
Okay. So what was your overall cost of dental education?
I graduated in 2019, so I joined in 2013 or 14. 18 lakh थियो ठ्याक्कै त्यो बेलामा.
18 lakh.
18
so
lakh.
for total 5 years.
Yeah, for total 5
Okay,
years.
not bad.
Yeah, that doesn't include instruments and everything that you have to buy
Okay.
on your own. But just the college fee was 18 lakh. I'm sure that's gone very up now.
Okay.
Yeah.
So what sort of exam you need to pass before qualifying to study dentistry? The entrance exam.
Entrance exam, yeah, there will be पहिला हाम्रो पालामा there used to be like a different for KU entrance, TU entrance, Dharan entrance,
okay, okay.
different यो हुन्थ्यो. अहिले चाहिँ I've heard that there is one single exam.
So is it the
I think it's generalized now. There's just one.
Driven.
Specify गरेको छैन होला. Or I might be wrong, but what I've heard from my juniors is they have just one exam in Nepal now. And then they let you choose the college or something.
Okay. So after getting your degree, Dide, after being registered as a dentist in Nepal, how hard or easy was it to get job in Nepal?
In Nepal, I worked in Japa. So
Where did they?
Birtamodमै I worked in a practice in Birtamod.
Okay.
Just for like less than 1 year. It was not very difficult, but then not very easy as well. It's more difficult in Kathmandu because there's more competition. Obviously. Yeah.
So what's the initial salary of a dentist?
I'll have to say it's very low.
Low as in?
Compared to cost of living in Nepal, I mean, there are people who have done very well, but initially, if you can...
Just to start?
I think Kathmandu I don't even have proper idea, but outside the valley...
I think Kathmandu it is a bit higher.
होइन थोरै चाहिँ छ
Kathmandu. Oh my god.
It's थोरै काठमाडौँमा. झापामा चाहिँ I don't know about now, but त्यो टाइममा चाहिँ 30 to 50,000.
Okay.
And then
Not bad.
You would get what you work as well, like कति काम गर्छ त्यो अनुसारले पनि हुन्थ्यो.
Okay.
But yeah, काठमाडौँमा चाहिँ I think it's a bit less.
So what do you think? What's the earning potential of a very reputed dentist in Nepal? Because in UK
there is potential in Nepal. I have my friends, even my seniors, who have their own practice. So
they're earning good money.
They do earn a good money. Again, it depends on how much you work. Like you can be a dentist and you can just work part time. You can be a dentist and work full time, even overtime, and make more money. So it just depends. But then if you look into jobs and not having your own practice, again, that depends on how much you work and where you are working.
Okay, Dide. You already had a dental degree from Nepal, but you still had to take exams in the UK. What were those exams and why?
I came here and I initially started as a dental nurse, like a trainee dental nurse. So I started as that. And in the meantime, एउटा route थियो त्यो चाहिँ overseas dentist can work as a dental hygienist or dental therapist here. There was a self-assessment route. That route is closed now. So I went through that route. So there was lots of paperwork, assignments, assessments and stuff. So I did literally everything. I started after I came here.
Okay.
English assessment, IELTS and lots of things. So exam चाहिँ थिएन त्यसमा. There's one thing that was not there was exam. So I did that, and then I sent my application to GDC. And in the meantime, I kept working as a dental nurse. And after 10 months, I got my registration as a dental hygienist. And I started working as a dental hygienist and started preparing for my dentist exam. There are 2 exams, so I cleared my part 1, and I'm waiting for part 2 now.
Good luck, Didi.
Thank you.
Okay. So what's the difference between dentist and dental hygienist?
They are both dental professionals that have very different scopes of practice. Not very different, but dentistry scope of practice is more wider. Like they can do lots of things in your mouth. Dental hygienist is more of a professional who looks more into your gum health.
Okay. So what's the initial salary?
For a hygienist? Again, it depends on where you are working, how much you are working. If you are working full time, you can start from per hour greatly when a 35 to 60.
Okay.
Depends on.
What about the annual?
Annual 60 to 50 to
initial.
Yeah, if you work full time.
Very good.
50 to. If you work full time, 5 days a week, 70, even more than that. Again, if you work less, full time as in your diary should be booked as well. If you see patients all day.
Okay.
For dentists who are more experienced, they earn like even more, like 80, 90, 100K. But initially, obviously, you'll have less salary. But then it's all about growth, isn't it?
Yeah. So do you have any 5-year plan, Dede?
5-year plan, the only thing I see myself is being more happier and content. And more as a personal life. I prioritize my personal life more than professional. Although I'm very committed to my career, but my personal life always comes first. So personally, I see myself more happy and content, and professionally more grown in my career.
Do you are you thinking to open your own farm? On clinic?
Not
in the
right
near
now.
Future.
Maybe in future. Yeah, not right now. I'm just in the path of getting everything sorted. And I'm very grateful for everything that I have as well professionally. So, yeah, maybe. We'll see.
We'll see. Yeah. Thank you so much, Didi. Thank you so much,
Wayne. Thank you for having me. It was so lovely to see you.
That's it. Thank you. Bye.
Thank
Namaste.
you. Bye. Namaste.